Yeah, this is a 88-year-old male, history of fall at home, diabetic, hypertensive, and patient has Parkinsonism. So 3D CT scan was done, and it has been found there is a posterior column fracture. Conservative treatment or fixation might be unsuitable for this patient. So I planned total hip replacement at one go. So incidence of arthritis following acetabular fracture is 12 to 57%. As a negative outcome predictor following fixation for acetabular fracture, age over 40 years, anterior dislocation, femoral head cartilage loss, old age more than 65 as having already osteoarthritic changes. And as Dr. Abhay told that Paprasky classification is not suitable for such cases. So we follow usually the Marmor classification, which has given new classification system based on 3D CT scan or 3D printing. Here we find out the corridor for fixation of our acetabular cup. So there are various corridors like anterior corridor, gluteal corridor, ischial corridor, superior pelvic ramus corridor to find out our fixation of the cup. And this is the dome zone, anterior zone, posterior zone, dome and posterior. These are the Marmor classification which is very suitable for fixation of the acetabulum. And this is based on 3D CT scan or 3D CT printing. So in this case, I found that there was a posterior column fracture, the superior fixation, and even the ischial corridor fixation was achievable. So meticulous pre-op planning with X-ray, CT scan, availability of all instrument and possible implant as backup, press fit, uncemented, porous coated, acetabular component with multiple screw fixation, custom-made cup with clustering of screw hole in direction of corridor, and use of screw augmentation technology with polymethyl methacrylate is suitable for such cases. Indication for total hip arthroplasty after acetabular fracture. Established post-traumatic arthritis, as patient has already osteoarthritis or avian changes, pre-existing.
Sir, please, arthritis. Can you just restrict yourself to the case presentation, sir?
So in this case, I did the total hip replacement and mobilized the patient next day. As you can see, we can mobilize. Strict non-weight bearing for 6 weeks is mandatory for such cases. There is another case, 68-year male, history of all post-traumatic acetabular fracture. Here, CT scan shows there is an anterior column fracture. I found the superior dome and inferior ischial dome is suitable for our fixation. I did the total hip replacement. And this is a 3-month post-surgery, and patient is walking comfortably. There is another case. This is a history of fall. There is a posterior column fracture in this case. So I tried to achieve fixation of posterior column with dual plating. Patient was all right. He started walking after 3-month post-op X-ray, and this was the 6-month post-op X-ray. Patient was started walking. This patient has got a sciatic nerve palsy. So after 8 months, he has history of fall at home, and he came with this way. So 3D CT scan was done, and you can find out the 3D CT scan where everything was at its place, but there was a femoral head fracture. So I planned the MDM, dual mobility cup in this case, and 3-month post-operative X-ray. Fortunately, it was 8 month, so sciatic nerve has recovered on left side. You can very well appreciate here, which was not in my hand. I was fortunate enough to get it. This is another case, 47-year male, history of fall at home. There was a history of RTA, diabetic, hypertensive. Here in this case, posterior column fracture was there. So I put a trochanteric and upper tibial skeletal traction for 1.5 month. And after 3.5 months, post-op patient came for, and this is a X-ray of after 3.5 months. So I did total hip replacement in this case. This is 6-week X-ray, 10-week, 6 month, and this is another case.
Sir, can we stop here, sir? Just we have shorter time, sir. There is another case presentation as well, sir.
Okay.
Can we stop here?
This is another case where there is an anterior column, posterior column fracture, both, almost global deficiency. So I just retained the posterior column with the posterior plate, and after 6 months, I did the hip replacement, 5-month post-operative X-ray. This is the walking of this patient. This is the last case.
Thank you, sir.
This is a fused hip, there is a morbid obesity, and as there is a various opinion whether to go simultaneously bilateral hip replacement. In this case, I did one hip at one time because of morbid obesity, and this is the X-ray, and this is the 3-month post-operative.
Thank you very much, sir. Thanks.
Thank you.